Dr. Dean Brenner, you have a different take on this data. You just say there's no data, then there's no data.
Well, Michael's got some new data here to support the idea that perhaps it might be useful to screen 75-year-olds, but his concern is that the U.S. Preventive Services Task Force at this point has no recommendation, and therefore you don't screen. And he's uncomfortable with that recommendation. I am. I'm very comfortable with that recommendation. The reason is that one doesn't screen unless one has positive evidence that there is indeed a mortality reduction. And if one does not demonstrate that mortality reduction at a cost benefit that is reasonable, and we know what reasonable is based upon cost-effective studies, then one doesn't do it. The default is you don't do something unless you have evidence, positive evidence, that indeed the screen and detection reduces mortality.
Mm-hmm. So you don't think that this suggests that is the case?
These data are somewhat suggestive, and they're new data to suggest that one might have to consider that, but there's still a lot of work that has to be done. One has to look ultimately at whether or not there is a mortality reduction in this group of people who've generally not been screened, and then recognize what the cost benefit are before one can make a final recommendation. But this is an outstanding study, the WHI, the Women's Health Initiative, and so he's coming from a very strong database with a very large, a couple 100,000 folks or something like that. And so this is a very good cohort. So it's an excellent use of a resource. It's a wonderful way to ask an important question. But at this point in time, I can't agree that we should be screening these women above this age because of the lack of cost benefit at this time. I think the Preventative Services Task Force will be able to utilize this data and possibly do a cost benefit analysis. They might have to develop some type of prospective study in this group. Women are living much longer now, and Michael makes that point, and I think he's right. And so people at 75 are no longer, quote, that old. I mean, people are women, women are living to 85, 90. And what he shows here that's really interesting that I think that was new to him as well as to me is that there's more aggressive disease in this age group than one would predict. Normally, most of us have seen estrogen receptor positive disease and less aggressive cancer in women above the age of 75. And that's partly what's driving U.S. Preventive Services Task Force recommendation. These data suggest that's not quite true. In fact, there's a considerable percentage that are having somewhat more aggressive disease. Is that because there's a change in the demographics, there's a change in the natural history of disease, that there's a change in the gene-environmental interaction that is actually changing the natural history of this disease in this age group? Could be. Is Michael finding that? Could be. So there's lots of reasons why this might be. And I think that it's something worthwhile following up, but I do not believe that right now the Preventive Service Task Force should make a recommendation to screen. But this does provide grist to perhaps consider in the future such things.
Okay.